People with atrial fibrillation have an increased risk of stroke. The Watchman procedure may be a good option for these people to avoid the lifelong use of blood thinners. Dr. Hetal Bhakta, a cardiologist in Palm Springs, reveals how this procedure works.
Atrial fibrillation is a condition where the electrical system in the heart malfunctions, specifically in the upper chambers of the heart. So the upper chambers of the heart are called atria. Their electrical system allows a coordinated heartbeat. When you go into A-fib, there is no more coordination, and it causes a short circuit which causes the atria to just quiver rather than contract properly. Atrial fibrillation traditionally has been treated with medications, where people get medications either to control the fast heart rates that result from A-fib or to control the rhythm of the heart. One of the issues that results from A-fib is the blood doesn't move very well in the heart. When it doesn't move very well because it's just quivering, it tends to clot. And those clots, if they dislodge, they can give you strokes. The way to treat the condition for preventing strokes from atrial fibrillation is to put them on blood thinners.
The Watchman device works by reducing the possibility of clots.
The strokes mostly come from the left atrial appendage, which is like a hole in the wall on the chambers of the left atrium. So the way Watchman works is it goes and seals that hole off. So once that hole is sealed, if there is no area for the clots to form, the likelihood of stroke goes down. So the Watchman procedure doesn't end atrial fibrillation. It gets rid of the risk of stroke without needing blood thinners to mitigate that.
Dr. Bhakta describes how the procedure is performed.
So the Watchman procedure takes about an hour to do, and it starts with putting you under general anesthesia, so you're not aware that the procedure is occurring. Then we get access to the vein in the leg, and then we float a catheter through that vein into the heart, and we identify the area, which is the left atrial appendage. Then we map the area properly, and then the device is sized according to the area that is mapped, and then the device is placed in to seal the area which is the left atrial appendage.
Technology is making this procedure safer and even more effective.
The placement of the Watchman device is a very safe procedure. In addition to its prior safety, the new technology developments that have occurred in Watchman has made it even safer and also faster to finish the procedure. The success rate on the Watchman procedure is close to around 98–99%. That day, the most pleasurable thing to see from a physician standpoint is the relief and excitement on the patient's face, because they've gotten rid of the blood thinners, which has been a significant source of worry and concern for most of these people, because they're at risk for bleeding or other trauma that occurs from other issues that they might have.
For an appointment, call Dr. Bhakta at 760-883-1600.